Hi everyone, how are you? This is Dr. Duane Scotti, physical therapist with SPARC Physical Therapy, coming to you here live from Hamden, Connecticut, over at Multi Sports Academy. If you're looking for some good personal training, small group training, larger group training, excellent facility, Dawn Tebets is your person to go to. Today I did want to jump on here because we've had a lot of runner success recently, and I wanted to talk to a bunch of you runners out there. If you are on live right now and you are watching this live video, then definitely write in the comment box that you're SPARC Live. And if you're checking out this video on the replay, type in the comment box SPARC replay. Let me know, just so I know who kind of watched the video live versus who watched it on the replay. I understand it's kind of early right now. A lot of people might not be out of work yet. They're doing the runaround with the kids. You got all the obligations going on. But today, really what I wanted to jump on and talk to you about is a couple of topics. So the topics we are going to cover today is how to become an adult onset runner. The other topic we're going to talk about is, do you have to stop running if you have pain? Another common question I get is, should you run on a treadmill if you have hip pain? And then lastly, we're going to talk about, can you run after having hip surgery? So let me give you some context here. So this all came about. With me this week. I was teaching my first year DPT students, doing some hip post-surgical lectures, and it got me thinking back to when I became an adult onset runner. So that's what I call myself. I just started running 9 years ago. I didn't run prior to that at all. So if you are an adult, and I actually had a couple of people actually reach out to me this week asking me, how best to go about starting to run. So they wanted to get on a nice little running plan, and they wanted to know, how do they go about doing that? So they've never run before. And the answer to this is that you can actually become an adult onset runner. So it is possible. You don't need to be running your whole life. So you didn't need to do track and field or cross country in high school. It is possible to actually run as an adult for your first time in your life. So my story really started back when in 2011, I actually had an initial onset of hip pain. So we were playing volleyball, backyard volleyball, Friday night lights, get together with the buddies and have a little tournament style. So now it's March Madness, so everyone could relate to a little tournament volleyball. And my buddies and I, this was about 9 years ago now, 8-9 years ago. And we'd get pretty competitive, of course, right? Because we thought we were still back in the high school, college days, and landed from spike volleyball, landed on my leg, felt a sharp pain, started getting kind of twinges in it. It would buckle. I was getting clicking. So I did what I know best, right? As a PT, I rehabbed it, and I did everything that I could possibly do to prevent going to that next level of care. And I got my hip a lot stronger, the pain went down, but I still was limited. So I still was limited, needed to get an MRI. They actually do that with dye to look at the actual labrum inside the hip. And I did have a labral tear that was more of a chronic tear. And then I did wind up getting a hip arthroscopy. So they go in with a little scope, little camera, and they suture down the labrum back onto the bone. So I had a labral repair, but I also had a loose body in there. So I had a piece of cartilage that tore off of the femur bone, so the ball inside the socket bone. And it was after that surgery when I was laid up. I was non-weight bearing on crutches for 4 weeks. And it was after that surgery that I, was getting active back in the gym again. And obviously I wanted to get in shape. This happened in January. And my surgeon, said, whatever you do, don't run on the treadmill. So this kind of goes back to our question of whether or not it is good to run on the treadmill if you have hip pain. And once I started doing some research on that on myself and educating myself a little bit more on what we call an anterior glide of the femoral head. So your hip bone, your femur bone can kind of glide to the front part of the hip, which is where all the structures are that most people who have what we call FAI, or femoral acetabular impingement, their problems are in the front part of the hip, and those structures are there, those sensitive structures. So with a treadmill, the only problem is the tread goes back. So the tread constantly goes back, and what it does is it pushes your femur bone forward, kind of to those structures that are in the front part of the hip, the labrum. And if there is any, like I myself had what they call a pincer impingement, so there's a little bone, extra bone growth going on in the front of the hip, and that would irritate the hip. So it's not recommended to run on the treadmill if you have hip pain or you have issues with impingement or a labral tear, things of that nature. It would definitely be more preferable to hit the road, because the femoral head's going to sit more in the socket because you're actually pushing down into the ground, and there's forces that come up into your hip bone. So it's actually a little bit better. I know a lot of people think about, running on the road is going to cause arthritis, and running on the road's bad for you. And it could be beneficial sometimes to do changing your terrain. So there are people who are trail runners and they like, running on the trail. It's a little bit easier on the hip, and that can be a good thing. I think variety is good. Variety is the spice of life, right? That could be a beneficial thing to switch up your surfaces that you are running on. So that was actually the first time that I actually went out for a run on the road. It was like February, and my surgeon's actually it was like March. Still a little cold here in the Northeast, and I was like, I never ran outside actually. Like, I only ran in the gym on the treadmill for cardio, right? Get your cardio and get a little lean before, after your workouts. And then I started running, and I went for my first run, and I never looked back since. It was the most amazing feeling I ever had. Getting outside, running, you get that kind of mental release, stress relief. It's just so good to be outdoors, especially if you are, more sedentary during the winter time. It's a really good thing. So I would highly recommend, if you do have hip pain, to not run on the treadmill as best as possible. Layer up, get some warm, gear. You don't need to go extreme either. Like, I run in single digits, and I'm not wearing like a ski outfit or suit. You just need to layer up properly. If you're wondering how you run in the cold, I did shoot a video on that, on all of the layering that needs to take place in order to successfully run in the cold. So if you check out my YouTube channel, that's probably the easiest platform to find the video. You can just go to the playlist that I have, SPARC Runner. You will see a video there of me in my mittens and hat and yellow reflective jacket, because you got to have safety when you're out there on the road, right? You want to make sure cars can see you. So that's the other thing, is if you are considering starting running as an adult onset runner and you haven't run before, I actually get these questions all the time. So which side of the road should you run on? You should definitely run where traffic is coming toward you, as opposed to running with the traffic. So it's the opposite of cyclists who actually ride with the traffic. When you are running, you should definitely be running against traffic, because that will make sure that you can see cars. Because nowadays, drivers are very distracted. Everyone's distracted on their phones, doing whatever. And there's definitely been, some times where I see a car swerving over. So I can see that, and I'm able to jump over. So make sure you're always running against traffic, and also that you're wearing reflective stuff and not going out in when the weather, if it's getting dim or darker at nighttime, you got to wear reflective stuff. Because as a driver, I get really upset when I see a runner at the last second and I hardly saw them because they weren't wearing any reflective gear. So this video here turned into a safety announcement for safe running habits. So make sure you're wearing reflective stuff. Make sure drivers can see you. I don't care how silly it looks. You're like very bright, but honestly, you want to be seen, right? You don't want cars coming close to you there. All right, so we covered treadmill running for hip pain. So the other thing is, can you be an adult onset runner? The answer is yes. So how are you going to do that? Progression, slow progression, right? And then also what we like to talk about, and talked about this last week in my post, is training in order to run, as opposed to running as your form of training, right? So what does that mean? That means you need to do hip-specific strengthening, strengthen your running muscles. So strengthening your hip muscles, strengthening your calf muscles, strengthening the muscles in a plyometric fashion, not as a beginner, but more if you do have some experience with your running, and you should definitely be adding plyometric training into your running. So again, I have written a blog post on all of these tips that get more in depth. So if you're interested in that, then definitely check out the blog post on my website, sparkyourtraining.com. You will find the blog post there, going through all those points. But if you do those things successfully, then you can definitely be able to run safely, healthy, effectively, even if you didn't run back in college and high school. All right, so just kind of being smart about your progression and not setting lofty goals for yourself. Just get, if you've never run before, definitely, start out with just a simple walk-run program. So you're going to jog for 30 seconds, then you're going to walk for a minute. Jog for 30 seconds, walk for a minute. Jog to the stop sign, and then walk. Because your body has to adapt. And see, this is the other thing, too, is I believe that, honestly, almost everyone, can run. And it's all about adaptation. Our body can adapt. We just need to allow the time for it to adapt. Most people jump up and progress too quickly, and then the body starts breaking down. You start getting knee pain, ankle pain, hip pain, right? So you start getting all those running type injuries. So progression is key. So anyone can run. So if you are an adult out there, you're looking to get healthy, there are many, many benefits to running. Obviously the cardiovascular benefit, obviously the physical benefit, the weight, management benefit. And honestly, for me, it's stress management, right? So mentally, like, we're all so busy, we're all so stressed, we all have such high workloads, right? Whatever we do, if my day starting out with a run every morning is like, I'm ready to kickstart the day. We're ready to go. So there are many benefits to running, and I do believe that many people can run as long as they do it effectively. All right, so that's kind of the adult onset running. We talked about treadmill. Hey, Clay, how are you? Good to see you on here. Stacy, how are you? Thanks for jumping on. Appreciate the support. So now I want to talk to you about kind of, should you stop running if you have pain? So this is another common question, and really the answer is going to be, it depends. So just like every answer, right? It depends, and it is really going to depend upon the type of pain. Is this your first onset of pain? In general, it is a little normal sometimes for muscles to be sore, for you to feel some quote-unquote pain in muscles. Muscle soreness is fine. If it doesn't go away within a day or two, in general, then that means that this is more pathological pain, and you should get it checked out. So see a medical provider who specializes in working with runners. The most common running-related injuries that we tend to see are plantar fasciitis, right? So pain on the bottom of the foot, the heel, Achilles tendon, the back of the heel pain, the back of the ankle, then definitely knee pain, whether it's the front of the kneecap or on the side, the IT band, so iliotibial band syndrome. So both of those very, very common in runners, and there are some simple solutions to treating those. The key is getting evaluated and determining what is the root cause of the problem, and then addressing those issues. So if you have a mobility impairment, if you have a flexibility or stability issue, then addressing those things. So the runner actually I just saw just before, he's doing great, knee pain example, and his quads were on shutdown mode. So he had knee surgery, past knee surgery, never got his quads back to where they should be. So then because the quads are weak, then the tracking of the kneecap is not going to be correct. And he was getting some pain with running, especially running downhill. So that was causing him some pain. We did some simple manual therapy techniques to the quad muscle. We start to release some areas, and then we started to strengthen, stabilize. In just 2 sessions, he's noticing a difference in his running, especially running downhill. So those are the things. There are simple solutions. You should not be running through pain. Running should not be painful. It should not be a painful experience. All right, if it is, there's a reason why. And then I would recommend you definitely get evaluated and appropriately kind of put on a specific plan for you. So then lastly, we're going to get to the surgery thing. And this really relates back to, I was very reflective in looking back at my surgery and thinking about where I was back then. I started running on the road and then got the running bug, ran my first race, New Haven Road Race, did the 5K. It was actually funny. I was looking at the picture. It's the only picture I've ever purchased after you do those races. And just looking back at, then versus now, how small my quads were. But I finished 21:05, so pretty respectable for the first 5K. So in these last really 8-9 years, I've gone on to do, 16 half marathons, 20-something 5Ks, a bunch of 10Ks, and a 1 full marathon. And that was after my hip arthroscopy. So a lot of people and a lot of surgeons out there might tell you that, oh, you had surgery, yeah, you can go ahead and run, but just don't run any marathons or don't run any half marathons. That's really not kind of based on any specific research studies, anything like that. And my thought process, my mindset is if it isn't hurting and you're not getting any symptoms and you are training in order to run. So I'm very dedicated, very religious with doing my running specific exercises every single week. I'm hitting my glute abductors, my external rotators, my calf endurance. I'm rolling out, I'm strengthening my quads, my glutes, all kind of running specific training when I'm in the gym for my legs. And then kind of proper progression with running, proper training, proper footwear, all those things, covering those bases. There's no reason that you cannot go on and run if you've had hip surgery. All right, so that was just kind of me sharing my story, sharing the story of others that I've helped in the past. If this has helped you and you found this valuable, then just write down value in the comment section. I would just like to know that if this is some good information that you want to hear more about, then I'll be happy to jump on here live and do a bunch more of these. But if you are a runner and you're trying to stay healthy, but you can't train because of pain is stopping you from meeting those running goals, we have a unique treatment approach that focuses on solving these problems with a lot of the clients that we work with. So our goal is really to help keep you active and on the road, especially weather's getting nice. We want to get out there. We got a bunch of spring races coming on. We got the Cheshire Half coming up. Very excited about that. We're going to be sponsoring that. So definitely for those that will be at the Cheshire Half, come by my booth, stop and say hi. I would love to meet you. Our approach really is to keep you active and on the road. And that's really what we do, is we kind of guide you in recovering from an injury by modifying the things that you're doing in your training as opposed to eliminating it. So as opposed to going to a medical provider who's going to say, okay, you're a runner, you have knee pain, you know what you need to do? Stop running and go to PT 2 to 3 times a week for 6 to 8 weeks, and then come back to my office and tell me how you're doing. And then I might tell you that you can start running again. And then what do most people do is they go back to running the same amount of mileage that they were doing. So that to me is a flaw in the system where you're not going to get results. What I like to do with my clients is we're going to keep you active. We're going to modify your training. We're going to talk about your training load. How many miles are you running? What pace are you running at? Are you doing hills? Are you doing speed work? And then, okay, let's maybe ramp this down. We're not going to do speed work this week, and we're going to take your long run from 8 miles to, we're going to do no more than 5 miles. Can we do that pain-free? Yes, we can, while we work on the things we're going to work on in rehab, combining manual, hands-on techniques with guided, supervised exercises to really help keep you and get you stronger, so then you're pain-free and be able to perform at your peak level to get you back on the road doing what you love. So those are the things that we do at SPARC Physical Therapy. If that sounds like something that is of interest to you and you're having some pain with running and you're looking for some help in that area, then send me a message. The best place, honestly, to find a little bit more information about what I do with my clients is to visit my website. So it is sparkyourtraining.com. You will find everything there, the services I provide. There will be availability for you to get in touch with me. Also, feel free on Facebook, send me a direct message. I'll be happy to respond to answer any of your running related questions. So thank you all for jumping on, those that jumped on the live stream here on a Wednesday, hump day. Halfway through the week now. Hopefully most people are done with their work day and we're on the back end of the week. So hang in there, and I hope you have a great day. Get that exercise in, and happy running. Thanks again, guys. Bye.